So I'm going to look at the randomised controlled trials of foam sclerotherapy and their comparisons with other non-surgical treatment modalities. I performed a PubMed literature search and a search of varicose veins yielded over 17,000 publications. Fortunately, I was able to narrow this down to 411 that contained foam sclerotherapy, and of this there were 24 publications that involved randomised controlled trials. 6 of these RCTs compared foam with liquid sclerotherapy, 2 compared foam with endothermal techniques, 3 compared foam, surgery and endothermal techniques, 6 compared foam and surgery, and the others involved different foam concentrations, different bandage regimes with foam, and laser treatments with or without concurrent foam sclerotherapy. The first paper is by Latimer, and he compared laser and foam on long saphenous varicosities. He looked at 100 legs, 50 in each group, and evaluated them at 15 months with duplex, a venous clinical severity score, Aberdeen varicose vein questionnaire, and a saphenous treatment score. And he defined technical success as a global absence of superficial reflux in the long saphenous vein. The results showed that laser and foam were equally effective in terms of eradication of global reflux, and all the remaining reflux was asymptomatic. And they found the VCSS and AVVQ and the STS all improved, so he concluded there was no difference between laser and foam. He also compared laser with phlebectomies against foam, again another 100 legs, 50 in each group, and he evaluated these at 3 weeks and 3 months with a duplex, an AVVQ, a VCSS and a venous filling index. He also looked at the 7-day pain visual analogue scores and did a microcosting analysis. He found that foam was considerably less expensive than laser, £230 versus £724 per session, with comparable effectiveness, although foam did require further treatments more commonly. So he concluded that foam was in fact cheaper, even if it did require further treatment sessions. Rasmussen looked at radiofrequency, laser, foam and surgery. He randomised 580 legs with long saphenous vein reflux, and he evaluated these at 3 days, 1 month, 1 year with duplex, quality of life and pain scores. He found the technical failure rate was supposedly higher in foam, around 16%, with slightly lower in laser and radiofrequency, around 5 to 6%, and about 5% in surgery. There was, however, no difference in the quality of life scores. Also, radiofrequency in foam recovered faster and had much less pain than laser and stripping. So he again concluded that all treatments were equally clinically effective. He then went to look at his 3-year follow-up and evaluated these with duplex at 3 years and quality of life scores. He found that 8 laser patients, 8 radiofrequency, 31 foam and 8 surgical patients had either recanalization or failed stripping of the long saphenous vein, and similar numbers in each group between 17 and 24 patients developed recurrent veins over the 3-year follow-up. All the groups, however, showed improvement in their quality of life scores. So he concluded that all treatments were equally effective in improvement of the VCSS and quality of life scores, although more recanalization was seen after foam. Bierman and his colleagues looked at laser, foam and surgery, and he randomised 240 patients, again with long saphenous reflux, and looked at these at 1 year with a duplex, a CIV-IQ score and Euro-Qual. He also looked at complications and SEEP scoring. Anatomical success was around 88% in surgery and laser and 72.2% in foam, although the vast majority of all of the patients treated showed an improvement of their SEEP score. He found that all the methods had a low complication rate. So he concluded that laser was fairly equivalent to surgery and slightly more efficacious than foam in terms of occlusion, but all the groups again had a significant quality of life improvement. Pretendon and et al. Recently published foam versus laser versus surgery in a multi-centre trial of nearly 800 legs, and they evaluated 6 months at 6 months with a disease-specific and a generic quality of life scoring. They found the quality of life scores were similar, except there was slightly worse disease-specific quality of life in foam rather than surgery, and the procedural complications were low, 6% in foam, 7% surgery, 1% in laser. So they concluded that all treatments were efficacious, although they were slightly lower in laser, and ablation rates were lowest in foam, 55% versus around 83 to 4% in laser and surgery. So in summary, foam seems to be as effective as radiofrequency and laser in terms of improvement of quality of life. And although foam does not seem to be as effective in eradicating reflux, this is possibly of questionable clinical importance, and it's likely to be the most cost-effective. However, further RCTs are required to compare the different techniques of foam administration and also with a longer follow-up. Thank you very much.